Every single movement you make relies on a flawless electrical command system. It starts deep inside your brain. To take a single step, your brain fires a signal that travels down the spinal cord and tells a highly specific muscle to contract. That contraction pulls the bone, and your body moves. But if a developing brain experiences trauma, like oxygen deprivation, a stroke, or a severe infection, before, during, or shortly after birth, this command center sustains permanent damage. We see this elevated risk in premature infants with low birth weight, when the brain is in a highly fragile state of development. This early damage leads to a condition known as cerebral palsy. Medically, it presents a unique paradox. The brain injury itself is completely static. The actual damage to the tissue will never get worse. Yet this non-progressive injury remains a massive, compounding physical challenge. The brain's software glitch is static, but the child's bones and muscles are constantly growing. Over time, that creates a cascading mechanical mismatch throughout the body. Because the brain is so highly specialized, cerebral palsy looks vastly different from person to person. The physical symptoms a child experiences depend entirely on which specific region of their brain was injured. For example, if the damage occurs in the motor cortex, the brain loses its volume control. It fires too many signals, leaving muscles in a constant state of tightness and hyperreflexivity. We call this spastic cerebral palsy. Doctors categorize this further by mapping out the geography of those tight muscles. Diplegia affects mostly the legs, hemiplegia affects one side of the body, and quadriplegia affects all four limbs. But if the injury strikes the basal ganglia, the brain loses its ability to inhibit movement. This causes dyskinetic or dystonic cerebral palsy, characterized by involuntary writhing and twisting motions that the person cannot stop. Finally, damage to the cerebellum ruins balance, depth perception, and fine motor coordination, resulting in the shaky, unsteady movements of ataxic cerebral palsy. A person can also have a mixed type, exhibiting a combination of these symptoms. And because these motor control centers sit right next to other critical brain regions, these physical challenges often overlap with cognitive, visual, or speech difficulties. The ultimate mechanical consequence is severe. Because the brain is constantly sending faulty signals, the muscles are constantly pulling abnormally on a growing skeleton. Without intervention, that relentless tension will warp bones and permanently shrink the muscles. Modern medicine cannot yet cure the software error inside the brain, so treatment focuses entirely on engineering and maintaining the body's hardware. This makes physical therapy an absolute necessity. It is a daily, mechanical intervention. Precise stretching and positioning, often assisted by specialized orthotic braces, physically fight the relentless pull of spastic muscles to prevent contractures, which is when muscles shorten permanently. Strength training is also critical. Cerebral palsy causes muscles to constantly fight one another, which leads to severe chronic fatigue. Physical therapists work to build up the surrounding muscle groups to better support those vulnerable joints. Then comes functional and transfer training. This teaches patients the sheer mechanics of independence, figuring out how to safely shift their weight from a chair to a bed, or how to walk effectively using an altered gait. Specialized equipment even allows patients who can't stand on their own to safely bear weight. This vertical compression is a mechanical requirement for healthy bone development in growing children. Through these daily, targeted mechanical interventions, therapy works to prevent structural collapse and keep the body as functional as possible. The most remarkable part of this physical work happens in the brain through neuroplasticity. While the initial damage is permanent, the neural network is highly adaptable. Repetitive movements performed in therapy teach the brain to build new pathways, wiring new connections to bypass damage zones. Cerebral palsy is a lifelong challenge that demands immense daily resilience. But by decoding exactly how the brain was injured, we can use targeted physical therapy to rewrite the body's mechanics, helping individuals maximize their mobility and their independence.